When I was diagnosed with PBC, my hepatologist explained to me that men were in the minority of the patients that had PBC. They represent only about 10% of the total patient population. My father and I fell into that category. After Elaine and I got married, we decided that it would be a really good idea if I had some life insurance. So after a period of time, we decided to up that coverage. And when we applied for more life insurance, well, they did a blood test. And the blood test came back with liver abnormalities. We got the blood test back from the hepatologist, and my wife and I shared those. So she knew immediately when I knew that I had PBC. We were both wondering how that would affect our marriage and the rest of our lives. I knew that we needed to do something about it. So I went back to see the hepatologist and followed his instructions about medication to take. My primary care physician, my cardiologist, my hepatologist, and my nephrologist all communicate with each other so that any tests that I have with one of them is reported back to my primary care physician. Presently, I see my primary care physician every 6 months so that he can monitor all the issues that I have in my life as far as health issues. And I see my hepatologist every 6 months so that he can monitor my PBC. Remembering to take medications is very important. I have a system that I use to remind me to take my medications, and it's pretty simple. In the evening when I come in, I take my medication and I put the bottles upside down. But if I get up the following morning and the bottles are not turned upside down, I know that I have forgotten to take it the night before. And it's worked well for me for a long time. My wife and I are a team. We take care of each other. We remind each other of things that affect our health. When necessary, we both go to visit our physicians together so that we can remind each other and keep up with each other's health.
When I found out that he had PBC, of course I wanted to know more about it. So I went to the computer and looked it up. I also worked in the medical field, and that helped me a lot to find out, what it was and what the outcome could be, and what he needed to do. So everything that the doctor told us, plus our research, was what we depended on. We made up our minds that he was going to survive and he was going to do what he was supposed to do. So, and he has so far. I mean, he's done everything that the doctor has told him to do. And if I met someone whose husband had PBC, I would tell her that she would need to support her husband, that there are support groups out there for her, and she needs to make sure that he follows his doctor's orders, because you can still live a full life with PBC. Wayne and I get along really well. I'm not saying that we don't have our disagreements and everything, but he is funny and he makes me laugh a lot. And when I'm sick, he takes really good care of me, and we're just together.
My wife and I belong to a primary biliary cholangitis support group. We're both very active. She attends all the meetings with me. We're involved in trying to further the purposes of the support group. When I attended my first meeting with the support group for PBC, I walked into the room to probably 15 people sitting around the tables. And that was the first time that I had ever seen anyone besides my father who had PBC. It was comforting to know that, there's other people here, that you're not sitting here by yourself, you're not alone. You know, I'm a very fortunate person to be able to do all the things that I do, like show dogs, cut grass, still work at a job. You know, I take my medication, I follow my doctor's orders. I think my future is full of lots of fun things to do. I think my wife and I will be doing dog shows, visiting family. We haven't been on a cruise in a long time, but maybe going on another cruise, maybe going to another country. Just enjoying life.